the one overriding virtue that I saw in the staff was cheerfulness. That they worked together cheerfully. They were not. It wasn't funny, but it was just a deep joy in what they were doing. One day I heard a man singing. It was singing something like "My Wild Irish Rose," or something. And I thought, what is that? And so later I saw him, a doctor, and I asked him, I said, did I hear you singing? He said, yeah. He said, I love what I'm doing. I love, and he had altered the words to "My Wild Irish Rose" to fit his profession. That was kind of typical of the hospital, from all the nurses, the doctors, maintenance, food service, housekeeping. Everybody worked together like a good machine, and they were happy doing their work, happy working together. The way they greeted one another. So it was obvious that God was present there. There's a saying of some saint that joy is the surest sign of the presence of God. Not a giddy, laughing joy, but a deep, abiding joy that the staff at all levels, everybody is helping to make people's lives better, to get people through the crisis that they were going through with somebody in the hospital or the actual patient in the hospital.
And I know the hospital continues to continue our mission of healthcare and the ministry that they carry out every single day. And I just want to thank all of our employees and throughout the system for continuing to carry out the mission and to follow the values that we have established, and those values are still with us. When you look at the values, they're just words, but also you have to live out those words. I think it's in living out those words that really becomes a part of you. And once it's ingrained in you, it's just like anything else. You don't even have to think about it. It will just be a part of who you are. And you just do the right thing at all times.
One thing we always feel is don't talk at people, talk to people. Because I'm sure some of us have experienced someone just talking at us, treating us as a thing. And I think one of the important things is to treat people as people and be kind and patient. I think it's very important for us to continue the ministry of the health care, caring for people, helping them to get well, get back on their feet. I mean, that's what we're trying to do, whether doctor, nurses. But I also want to recognize our housekeeping, our dietary, maintenance.
Each time you as an associate encounter somebody, you, for that person, are CHI St. Joseph. You are the one that's representing the whole system. You're the one that's bringing that compassion. Whether you're registering somebody, a patient, whether you're greeting a family member, whether you're changing an IV, whether you're assisting in surgery, whether you're mopping a floor, you're the one at that moment that has the power to greet somebody with grace and respect. And that makes a difference. It can make a huge difference in the whole experience that person has while they're within that system. Another thing I want to share is that there are still visible signs of the sisters in some of these hospitals. But there's also a spirit that walks in those halls, in all those places where it's a hospital or a doctor's office, wherever. That spirit, that charism of charity, that's still there. When we left, we didn't take that with us. That mission is still there.